she was able to go home after 2 or 3 days. I don't know how many. One of the other things that we do is a lot of whelping, and whelping is when they go ahead and give birth to puppies. In cats, do you know what it's called? In cats, it's called queening, when they go ahead and have babies. Usually the dogs that need help having babies are going to be small dogs, because they just don't have as big of a passageway for things to pass, and so things go ahead and get caught in there. Big dogs we typically don't have to do a lot with, because there's a lot more room in there and things move around. But these are a couple of big dogs that we did, or that we were able to do a C-section on. One was a C-section, and then the other one we gave medication to, and that stimulated her contractions. So this one got the oxytocin. And what we do is we take x-rays first so that we can see where the puppies are. They have to be aligned appropriately, because they can only come out head first or rear legs first. They can't come out all four legs first or back first. And so once they're aligned appropriately, then the medication will stimulate the uterus and they'll go ahead and give birth. This one over here, that wasn't possible. And so what we needed to do was take her to surgery and then do a C-section or cesarean section, where we had to open her up, pull the puppies all on out, and then close her up afterwards. This is an x-ray of a pregnant bitch, and you can see the puppies in here. I kind of showed you on that other slide what to look for in x-rays, but what we've thrown in here is we've got some puppies. Anybody got any idea how many puppies there are in this dog? Okay, you have to count spines, or you can count the heads. A little bit easier to see over there. Maybe. You're seeing how many? Over here? I did hear the correct answer. But this is her on her back. So heads up here still. This is all going to be food. So we're looking for spines, and keep in mind they're going to look like her spines. And so if you look real close, you can see we've got a head and a spine right here. And then we've got, here's the head right here and the spine over here. So there are 2 of them. You always take 2 x-rays because you'll get a different view of them. I think there's actually 3. There's a spine right there. On this one you can see, here's the head and spine here. Here's the head and spine here. And then there's one back there. So actually 3. What we see a lot of are dogs that tend to dive over things and then get impaled in it. So I actually had several different slides of dogs doing this, but you can see right here, this is a Weimaraner or something. So laying on its side, heads up here, and then you can see where he's trying to dive over, pretty good size stick over there, and it's stuck inside him. So it's gone in here, it's gone behind the leg, and it's come out over here. As far as other things that are going on in this picture, this is the IV catheter down here that you go ahead and give jugs through or fluids. This is a blood pressure cuff. Up here you can see this is the ventilator. The dog's on the ventilator while we're doing the surgery. This is to go ahead and keep the dog warm because you have to maintain their body temperature. And what this is a chest tube. Because once we went ahead and took the stick out, it actually went through there and then behind that front leg, and then it was stuck inside the chest. And so you can't really have extra things inside your chest up against your lungs. So once we pulled that out, it had let a lot of air in there, so you need to put in a chest tube afterwards so you can keep sucking out the air until everything seals over. And so this bandage is holding it'll hold this in place. This is a drain tube because there was a lot of space in there when the dog went ahead and got impaled. And so what this will do is help stuff drain out of the dog. And then this just kind of shows you how big the stick was that was in there. We had one dog a couple years ago with one of these stick injuries where the stick actually went inside the heart, and it was sticking on the outside. And so if you looked at it, you could see the stick vibrate a little bit. We sent the dog to Michigan State. They did open heart surgery on him, took the stick out, and the dog did just fine. And won some sort of award for it. The dog did. This is a bite wound in a dog, and so when they come in, this is what they'll look like. And then what we have to do is go ahead and, remove all the hair from the area so you can see what you're dealing with. But all the injury isn't just in this little tiny area because the skin has gone ahead and been pulled up, and so there's damage to the tissues underneath. And so what's happened is, we had to go ahead and open up the dog, and there were injuries all along underneath there. So we had to clean all the tissue out of there, close that area, and once again, you see another drain tube. And the dog did just fine. I see one of these dogs every weekend. They don't fight with the porcupines. The porcupines don't attack them. They attack the porcupine. And they'll come in different sizes. Sometimes you'll see really big quills. Sometimes you'll see little tiny quills where, they got a baby porcupine. They're not going to learn. They're going to go ahead and do the exact same thing again when we see it next time. The majority of the quills that we see end up in their mouth because they're biting them. And so the porcupine's not shooting his quills at them. The porcupine is just an innocent bystander, and these are all getting stuck in there. But what we typically see, and you can kind of see in this one right here, is that when they bite them, the quills will also go into the hard palate and into the tongue, and a lot of times both. And then the quills will kind of lace together, and the dog can't open its mouth up. And then, people, of course, will start pulling them out. I mean, that's all you have to do is just to pull them, and they come out. They don't have some magic barb on them or anything like that. And if you, pull the quill out and toss it down, and then you walk over it, you're going to get quilled too. I mean, these things are really sharp. A lot of times we'll have people go ahead and try and do all this at home, and they're holding their poor dog down, struggling with them, and then they'll start breaking the quills off. If you break the quills off under the skin, then what happens is they stay in there until someone like me can go ahead and either dissect down to them and pull them out, or a lot of times you're not able to get them all out that way. And then what ends up happening is they start migrating through your body, and then they form granulomas around the area, and then it'll look like the dog's got like lung cancer, or a lot of times they'll collect in this area here, so it'll look like they've got some sort of glandular cancer. So when you see these guys, the dog needs to be anesthetized so that you can remove all of them. They're not just going to fall out on their own or anything like that. And sometimes they need multiple procedures because there's just so many. I mean, we probably do on each dog, we probably take out about 300. Big thing that we see are fractures. So this is actually a fracture of the front leg. Can you see where the fracture is in this picture? So that's a fracture. You've got two bones in the front and that part of the front leg. And what's kind of nice about fractures here is this is kind of like an internal splint that'll kind of brace this a little bit. But this is a dog, this is a big dog that the x-rays actually from. Big dogs are going to end up needing surgery, and that may not be surgery that can be done locally, it may need to be done by a specialist or an orthopedic surgeon. And so then you're looking at going to like Michigan State or to one of the big veterinary clinics in Detroit area.